After a bilateral lumbar sympatectomy, a client has a sudden drop in blood pressure, but there's no evidence of bleeding. What should the nurse identify as the most likely cause of the change in blood pressure? Number 1, inadequate fluid intake. Number 2, consequence of anesthesia. Number 3, increased level of epinephrine. Number 4, reallocation of the blood supply. So again, after a bilateral lumbar sympatectomy, a client has a sudden drop in blood pressure, but there's no evidence of bleeding. What should the nurse identify as the most likely cause of the change in blood pressure? So the most likely cause of the change in blood pressure is reallocation of the blood supply, which is number 4. Because a sympatectomy causes dilation of the blood vessels in the lower extremities. The resulting shift in the blood volume lowers the systemic blood pressure. If we answer number 1, inadequate fluid intake, fluid losses associated with surgery may gradually lower the blood pressure, and this is compensated by endocrine and renal mechanism, and therefore this is not correct. And if you answer number 2, consequence of anesthesia is the most likely cause of the change in blood pressure, this is not right, because although anesthesia depresses vital signs, generally there is not a sudden drop in blood pressure post-op. And if you answer number 3, increased level of epinephrine, epinephrine will increase the blood pressure by stimulating cardiac contractility, and this is the reason this option is not correct.